Hello everyone. Our today's topic is on general anesthesia. Let us begin with the stages of the general anesthesia. We have four stages of general anesthesia: stage 1, stage 2, stage 3, and stage 4. The first stage is stage of analgesia. Stage 1. It starts from the beginning of anesthesia administration and lasts up to loss of the consciousness. So during this phase, the reflexes and the respiration they remain normal. So you have to continuously monitor the patient vital signs and level of consciousness. The second stage is stage of delirium. As the patient here he loses consciousness, apparent excitement may occur. The muscle tone, remember the muscle tone, it increases here. The jaw, they may get tightened, and there could be increase in heart rate and the blood pressure. So here the anesthetic. So here the anesthetist, he has to ensure the proper airway management, and he has to closely observe the sign of increased sympathetic activity. The additional anesthetic agents that may be administered to achieve a smoother transition to the next level. The third is the stage of surgical anesthesia. It extends from the onset of irregular respiration to cessation of the spontaneous breathing. Plane 1, plane 2, plane 3, and plane 4. In plane 1, remember the eyes they become fixed. In plane 2, there would be loss of corneal and laryngeal reflex. So in which phase corneal and laryngeal reflexes are lost? It's plane 2. In plane 3, there is a pupil dilation, and there are changes in the light reflexes. And in plane 4, the pupils are dilated, there is decrease in muscle tone. Apart from that, there is drop in the blood pressure. So in this stage, the anesthetist would monitor the vital sign closely, including the pupil size, their reflexes, and the blood pressure. The last stage is the stage 4. Here, the respiratory and the vasomotor control it ceases. So remember which is the critical phase. It's the stage 4, which is critical, where immediate action is required. So here the anesthetist initiate prompt intervention to support the respiration and maintain the blood pressure. He can also administer assisted ventilation and the cardiovascular support. So remember, this stage would require a clinical expertise to prevent the life-threatening complication. Now let us discuss the various general anesthetic agents. What are those? That could be inhalation, given by inhalation route, either as a gas form or in volatile liquid form. The example of the gas form is the nitrous oxide, and the volatile liquids, they can be halothane, enflurane, isoflurane, desflurane, sevoflurane, and methoxyflurane. Those that can be given by intravenous route, they can be either divided into three categories. The dissociative anesthesia. So you can get a question in your entrance exam: which of following is example of dissociative anesthesia? The answer would be ketamine. The second question you can guess is which one is an opioid? It's fentanyl. Which one are benzodiazepine? They are diazepam, lorazepam, midazolam. These are given by intravenous route and they act slowly. What are inducing agent? They can be thiopentane, propofol, etomidate, etc. Now the example of the inhalation anesthetics, they are nitrous oxide, cyclopropane. The volatile liquids, they can be isoflurane, enflurane, desflurane, methoxyflurane, sevoflurane. Example of the ultra short acting barbiturates is thiopentane. That is what you can get a question. Example of diazepam is benzodiazepam is diazepam, lorazepam, midazolam. Example of neuroleptic analgesia is, remember, ketamine, fentanyl. The opioid analgesic, they are morphine, remifentanil, sulfentanyl. Remember that for your entrance exam point of view. Now let us discuss their mechanism of action. So remember that the first target is the GABA A receptors. The inhalation agents, anesthetics such as isoflurane, remember, sevoflurane, they potentiate the action of inhibitory neuroreceptors that are the GABA A receptors. So remember, these GABA A receptors, they are the ligand gated chlorine channels. So when GABA would bind to these receptors, it would open the chloride channel that would lead to influx of the chlorine. That would cause hyperpolarize the cell membrane and making it more resistant to excitation. So remember, the inhalation agents, they would enhance the effect of GABA by increasing the duration and frequency of the channel opening, and that is why they would enhance the inhibiting response. The other examples are the barbiturates. They act on both GABA A and glycine receptors that would enhance the inhibitory neuroreceptors in the central nervous system. What is the action of ketamine? That you have to remember that. Remember that ketamine, it's a NMDA, that is N-methyl D-aspartate type of glutamate receptors. So remember, for your entrance exam, which of following blocks the NMDA type of receptors? It's the ketamine. So ketamine, it is the ketamine, it acts on the NMDA type of glutamate receptors. So by blocking these receptors, the ketamine would inhibit the excitatory effect of glutamine and thereby preventing the influx of calcium ion and reducing the excitatory neurotransmission. So these are the various mechanisms of the general anesthetics. Now, what is the difference between the general anesthetics and the local anesthetics? So the site of action, the general anesthetics, they act on central nervous system, whereas the local, the LA would affect on the peripheral nerves, the GA affect the whole body, and LA would be confined to some restricted areas. So it is preferred in major surgeries. The GA is preferred in the major surgeries, and in patient who had a poor healthy patient, its use is risky. Now the another important part is, what is MAC? MAC stands for minimal alveolar concentration. What do you mean by MAC? So remember that there are two words, one is MAC and other is blood gas coefficient. So the MAC, minimum alveolar concentration, it help us know how much anesthesia is needed. And the blood gas partition coefficient, it helps us to understand how quickly the anesthesia will take effect and wear off during the general anesthesia. Think of the MAC as the amount of specific inhaled anesthetic, like a gas you breathe in during surgery, that is needed to make half of people not react to standard incision or the stimulus. So if you have a high MAC, you need more of the anesthetic to achieve the desired result. Whereas the blood gas coefficient, remember that it is about how easily the anesthetic moves between the blood and the gas that is present in your lungs. So the blood gas coefficient tells us how much of the anesthetic dissolve in the blood compared to staying in gas phase in your lung. Low solubility, like the nitrous oxide, the anesthetic does not dissolve much in the blood. So this leads to quick onset and recovery time because the body can easily get rid of it. Whereas the high solubility, like with the halothane, that means that the anesthetic dissolves more in the blood. So that means that it will take longer to kick in and also longer to leave the body. So in simpler words, MAC helps to know how much anesthesia is needed, and blood gas partition coefficient helps to understand how quickly the anesthesia will take effect and wear off during the general anesthesia. Now let us discuss few important general anesthetic. First is the halothane. So remember, halothane, it is a powerful anesthesia that works fast, making both the start and the end of surgery rapid. So remember, it is not inflammable or explosive, and it has a sweet smell and it does not irritate. It has a minimal side effect. It does not increase mucus or saliva, and it has a low chance of causing nausea, vomiting after the surgery. Apart from that, it relaxes both the skeleton and uterine muscle, and it can be used in gynecology when the uterine relaxation is indicated. So remember that it makes it useful in childbirth when relaxing the uterus is needed, as it relaxes both the regular muscles and the muscles that are present in the uterus. Apart from that, it has a pleasant odor, and it is more suitable in children as a inhalation induction. Now, what are its drawbacks? So it's not the best at relieving pain on its own. So it is often used with other pain relieving substances like nitrous oxide or the opioids. And apart from that, it strongly slow down the breathing and can also affect the heart. It can slow the it can cause slow heart rate, and that can be treated with the atropine. Apart from that, in rare cases, remember its disadvantages, it may cause malignant hyperthermia, where the body temperature shoots up. So remember, halothane is strong, fast-acting anesthesia that is generally safe to use, and it comes with some drawbacks like not good for pain relief, impacting the breathing, heart rate, may cause liver issues, etc. Apart from that, it may cause a rise in the body temperature. The other is the enflurane. Remember, it is moderately potency. It has a less potent. It is less potent than the halothane, but it induces and it has a rapid induction and recovery. So it is metabolized into fluoride ions, which are then excreted by the kidney. So that makes it a safe process. The disadvantages are they can excite the central nervous system at twice the normal concentration and may lead to increased seizures. So remember that for your entrance exam point of view. Other is the desflurane. It has a speedy induction and recovery, and it is suitable for outpatient surgery. So it is less volatile. It decreases the vascular resistance and perfuse all the major tissue very well. Its irritation can cause apnea, laryngospasm, coughing, and excess secretion. Other is the sevoflurane. So which anesthesia has a low pagency, and make it less irritable for airway during induction, particularly suitable in children. It's the sevoflurane. It has a rapid onset and recovery, and it is metabolized by liver. Other is methoxyflurane. It is very powerful in providing pain relief during the anesthesia. Apart from that, its analgesic action, it is seldom used due to its association in causing the kidney damage. Other is the nitrous oxide. Remember that it is a powerful. It is not a potent as general anesthetic, but it is strong. It is a potent analgesic, but it is a weak general anesthetic. It has a rapid onset and recovery, and it does not depresses the respiration with no muscle relaxation. So it can be commonly used in dental surgeries, during childbirth, for post-operative physiotherapy, and it is also less harmful to liver, not teratogenic, and does not cause any bone marrow depression. The intravenous anesthetics example are the barbiturates. They are as powerful as they are a potent anesthetic but weak analgesic. So remember, all barbiturates, they can cause apnea, coughing, chest wall spasm, laryngospasm, and the bronchospasm. Other is the propofol. Propofol, remember, it is derived from phenol, and it is used as IV for sedation. So it has a rapid and smooth, usually take around 40 seconds. So it lowers the blood pressure without depressing the heart muscles, and it also reduces the intracranial pressure. So it has been generally replaced with the thiopental, as it causes a euphoric feeling without causing any post-anesthetic nausea and vomiting. So that is why propofol is generally preferred. Other is ketamine. Ketamine, it is a short-acting anesthetic. So it provides sedation, amnesia, immobility, and also act as a potent bronchodilator. And that is why it is preferred in asthma patient. but it is, remember, contraindicated in hypertensive or stroke patients, and it is mainly used in children, elderly, for very short duration. Remember, it also increases the cerebral blood flow and may cause hallucination, particularly in the young individual. Other is dexmedetomidine. It has a unique ability to provide anesthesia without causing any respiratory depression. It is sedative, analgesic, sympatholytic, and anxiolytic effect. So these were the various agents in the general anesthesia.